What's happening? Ben Manning here today from etherFAX. He's joining us, talk about fax software. What's happening, Ben? How are you today?
Hey, Andy, I'm great. How are you today?
I am awesome. It's good to see you again. Good to have you back on the show. We are here to catch up with you. It's been a little while. You guys have been doing some special stuff that I wanted to kind of review for my viewers. Why don't we first start off with a little bit of background? Who's etherFAX? Who's Ben Manning? What do you guys do?
Yeah, so etherFAX was founded back in 2009 by some of the leading experts in both the faxing as well as the telecommunications space. And so, this day and age, whether you're implementing a fax solution for the first time, maybe you're extending your legacy fax solutions to the cloud, it's really important to look for a fax service provider that's going to meet you where you're at today. And that's a big part of what etherFAX is, one of our mantras, meeting you where you're at today. So we've put our fax infrastructure into the cloud. That's essentially what etherFAX is founded on. And since we did that back in 2009, we've been developing some innovative solutions around the way enterprise organizations both send and receive information. And we really think about faxing less about two modems hissing at each other and more about the secure exchange of data and documentation between two endpoints. So that's really where we are in terms of etherFAX, a little about who we are. And really what we're trying to do is we're providing an off-ramp to today's traditional telephony faxing and an on-ramp to cloud-based secure document and data exchange. We call the backbone of our system, our ecosystem, we call it our secure exchange network, which allows any two endpoints to connect to each other without going over a phone line, two faxes hissing at each other, essentially. So,
well, let me stop you there. And
yeah.
just, here's a technology that's been around forever, right? I mean, it's really existed a lot longer than I think any of us could have predicted. Why is it still out there? How's it still out there? It's been years since I've heard of anybody actually buying a fax machine. I don't even know if you can still buy them very easily. How is this technology still out there? And how did you guys jump in there and decide this is a place that, we can still help and offer a lot of opportunity?
Yeah, it's an excellent question and one in which we get pretty much every single day. And a lot of probably about 70% of our volume is in healthcare. So while we do have insurance companies that we work with and banks and regulators and things of that sort, the vast majority, 68 to 72% on any given month, if we do a traffic analysis, is in healthcare, right? And so, yeah, we get it. It's hard to imagine in 2022, here we are talking about faxing. The reality is you can look at studies that show there are 9 billion pages a year being faxed in healthcare.
Wow. Just in healthcare.
Just in healthcare alone, 9 billion, right? That same study showed that roughly 70% of hospitals report using fax, both as a means of sending and receiving a summary of care records. And even in today's day and age with portals and APIs and all these other ways of passing data back and forth, 25% of hospitals still use fax for processing prior authorizations.
Why do you think that is?
It's easy and it works. If you look at some of the Firebase standards and HL7 standards, there's a lot of pieces of information that go into that documentation that has to go back and forth, and it has to meet certain minimum standards to go back and forth. I can just walk up to a fax machine, put in the piece of paper, hit the 10-digit, type in my 10-digit number, hit the shiny green button, and it goes. And it gets securely delivered on the other end. It's a HIPAA compliant means of communication versus email is not HIPAA compliant, right? And I don't have to worry if I'm a sender, I don't have to worry if the receiver wants to get a piece of paper fax, if they want to get whatever their documentation type is. I know that I need to send over this patient summary of care in order for you to provide the treatment for that patient. Here it is, and it's the simplest thing that I can do, and it just works. So
So you mentioned healthcare. You're not. It's not the only area you focus in. You actually play in a lot of the markets the verticals that you mentioned. But healthcare is a big one, right? And you've had some integrations over the last couple of years that you guys have added to your portfolio. So one of them was Epic. We talked about that. I think we talked about that last year, in fact, or somebody at etherFAX chatted with me about that. But talk to me a little more about healthcare. Why is there such an opportunity in healthcare, and how does etherFAX play into that? And then for viewers watching this, how is this a solution that can really help them with their customers, add some money at the end of and add some revenue into the account, maybe take some steps out of the customer's process? How can healthcare, what are some things that they're looking for in healthcare?
Yeah, so a couple of good questions in there to unpack. In terms of the revenue side of things, we can really reduce the cost of ownership, total cost of ownership in regards to faxing. There's still going to be faxing. It's going to exist. It exists today. But if you switch to an etherFAX account, you no longer need to have the on-premise fax boards. You no longer need to have all of the costs associated with having an on-premise fax board, from installing, upkeep, maintenance, et cetera. It's really expensive to have an on-premise fax solution. So by us creating a fax board in the cloud, you can rip and replace all of that. And it doesn't take you a year to switch over anything. It is basically, you plug in a cable. If you can, we like to say, if you can Google, you can fax, or you can etherFAX. So we're displacing those costly physical fax boards and all of the annual maintenance associated with them. So that's one big piece of the puzzle in terms of cost savings. No PRI lines or T1 lines, no phone lines, no fax boards, et cetera. So that's a huge cost savings for a hospital system. The other piece of that is in terms of integration. So the Epic App Orchard integration in particular. So we've got two different Epic App Orchard solutions. If you go into the Epic App Orchard, you'll just see etherFAX as a solution, but we really have two ways to implement that based on what's best for the users at that particular hospital system. And one of the things that we think about in terms of interoperability is meeting users where they're at. The notion of healthcare interoperability just doesn't work if you are requiring users to change all of their workflows or all of their habits. If they can keep doing what they're doing today and interoperability just works on the back end, it solves it for everybody. So really we've got a direct integration with Epic in which we're just using the Epic print services and the Epic fax interface that already exists within Epic today. So you type in that 10-digit DID and you hit the fax button and you're sending out of Epic, but you're using etherFAX as a delivery mechanism on the back end. Provides all of the benefits that we have around security, as well as the endpoints, and not having two modems hissing at each other. And then we'll deliver that response directly back to the originating Epic system of the fax status of being delivered, et cetera. The other solution, the way that we implement our Epic App Orchard is through what we call a local instance. We do that through a solution called Eris, which is the etherFAX remote integration solution. And that's an on-premise hosted solution, but it's not a local fax board or not a fax server. It is a small Dockerized container. It sits behind your firewall. You've got full control of the privileges. And just like the local solution, it's fully supported in the Epic App Orchard. So just two different ways to kind of tackle that same solution of faxing out of Epic.
Very cool. Very cool. So opportunities when they're out there, when the sales reps out there in the field, what are they looking for? Especially, you're in a healthcare account that can be anything from a doctor. It could just be some of the healthcare administrative offices. It could be urgent care places, hospitals, insurance companies, right? Anything within that in that vertical market. So what kinds of things would you recommend that sales reps be on the lookout for?
Yeah, so a couple of things that we point out. One is finding people that are sending and receiving the faxes and asking their pain points. You'll get a lot of them. Still faxing, people still don't like it. But really what we try and focus on is the workflow. What happens with that fax document when it comes in? Who's the one touching it? A lot of times what we see is going into an account and you're finding the communications engineer, or the IT engineer, or someone along those lines. And really where you need to get to is the end user of the actual fax itself, and ask them, hey, how many times do you get a busy signal when you're sending out a fax? How many times do you have to resend that fax? With our secure exchange network, we have 100% guaranteed delivery from the end-to-end points on the secure exchange network. There's no busy signals. We are going to guarantee that documentation is going to be delivered. And so, asking questions about how long it takes to fax large documents. We run reports every Monday. We see faxes that are sometimes 1,200 pages, 1,400 pages, and
Wow.
We're sending them in a matter of 2, 3, 5 seconds across our network. Think how long, ask the question, how long is it going to take for a 1,300 page fax to be delivered from one end to another? And how much time did you tie up that one particular DID with a busy signal for every other fax you were trying to receive during that time? and how many of those faxes never came through. And if you're thinking about something like prior authorizations or billing, or if you're an orders management system, how many orders are you missing by faxes not coming through because of a busy signal, by faxes not coming through because your phone line's tied up? There's the real opportunity cost for implementing etherFAX.
Makes a lot of sense. Especially in healthcare, right? There's just, they're relying on it because of the security. And it's kind of, I think what you alluded to earlier, which is it's sort of always been there and they all know how to use it, right? It's simple.
We maintain HIPAA compliance, and we just renewed our high trust certification. So everything that goes across our network is PCI compliant, HIPAA compliant, high trust certified. So security is top of mind for us in everything we do, because there's so much personal health information, or PHI, that traverses the etherFAX network.
And back to that, you mentioned earlier pages that are going through healthcare. What were your estimates on fax pages going through healthcare?
Well, we see about 75% of all communications between two clinical care teams at hospitals going over faxing. So whether it's my summary of care records, things of that nature, 75% of all of my patient information between two clinical care teams. And we focus on clinical care teams as a metric. That doesn't count for things like billing, revenue cycle. All of that is still huge in healthcare as well. But it's just amazing to think, if my doctor wants a piece of information about me from another doctor at another hospital system, 75% of the time it's going to be a fax.
Wow. And so basically you've just simplified a very complicated process that years ago was pretty much all hardware. Now it sounds like it's mostly, if not all software.
Yep. Yeah, absolutely.
Very cool. Very cool. Well, thank you so much for taking the time to come on and talk to us about healthcare opportunities and etherFAX, and remind us, what you guys have going on out there. The integrations are very, very cool to see. We get, it seems like we get new ones every 3 to 6 months out of you guys. So keep it up, keep it up. Say hi to everybody down there in New Jersey for us, and look forward to talking to you again. Thanks so much for coming on today.
Sounds good. Thanks, Andy.
Take care, Ben. Bye-bye.